So I'm going to do the skills of tracheostomy suctioning and then trach care. I've gotten my supplies all ready for suctioning. I've got the container that has the suctioning cannula or catheter. I've got some water. I have a drape for across the patient's chest, and I have the container for trach care cleaning. I also have a stethoscope and an O2 meter just so I can make sure the patient's doing okay. So I go ahead and check the room for precautions. Come on in. Hi, Mr. Smith. I'm Alex. I'm just gonna come over here and get your privacy. So I'm just here today to go ahead and do your trach care, and we're gonna do a little bit of suctioning for you. So I'm gonna put this over here for a second. How are you doing today? And I'm gonna go ahead and put your bed up. So, Mr. Smith, can you tell me your name and date of birth?
Miss Lee Smith, 1971, 1939.
Great. All right. And can you tell me, are you allergic to anything?
No.
No adhesives or latex?
No.
No? Okay. I'm going to put you up nice and high here. And I'm just going to take a look there. All right. So before we begin, I'm just going to go ahead and put this on your finger. Just going to check out your O2. Oh yeah, your O2 is around 88 right now. So let me take a quick listen. We do some hand here, hygiene. And I'm going to take a quick listen to your chest. Great, yeah, I'm hearing some ronchi and some gurglies in there. Yeah, okay. All right, so I'm gonna go ahead and put this here. Do some, go ahead and do hand hygiene again. So first I'm just gonna go ahead and make sure that everything is set up over here. I'm gonna do a little panning of the camera. All right, so we're gonna go ahead and hyperoxygenate you. Before we do this, make sure that you've got enough O2 in you. Oops, I turned this all the way up. It's really loud. And I'm going to get our suction going to 80 to 120 millimeters of mercury. And I'm going to go ahead and put this over here for good access. Great. And I'm just checking to see your cannula there. Okay. And you're up high enough. And I'm going to go ahead and give you a drape for both of these things. Okay, wonderful. So I'm going to go ahead and do hand hygiene again. I'm going to put on some clean gloves. And I'm going to go ahead and...
Did you say that it was set to 180 over?
I did.
Okay.
80, between 80 and 120.
Great job.
Great. Doing this, I've got some clean gloves. I'm going to wipe my space down here. Get that ready, and I'm going to go ahead and toss that. Let's see. Put that over here. Okay, so now that that is, oops, if I touch below, I would go ahead and re-sanitize here. Okay, and got some clean gloves on. I've got my suction container here. Making sure to keep my hands up here. All right, so I'm going to go ahead and, let's see, let me take these off. I'm going to do hand hygiene again. And I'm going to, oops, you didn't see that. And we're going to open this. Hold on, I'm going to do this. All right, and I've got my gloves here. That's probably not going to work very well. There we go. Got those, my gloves. I'm going to go ahead and carefully take my container, being careful of the sterile field there. We'll go ahead and open this and get this ready. We've got some water. Okay. One more time, I'm going to do hand hygiene. And I'm going to go ahead and take my gloves.
Clean gloves. Gloves on. I'm going to remove the O2 source.
And
I'm going to remove the
let's see.
cannula using a clockwise motion.
You were supposed to use the clean gloves to take out the cannula first, right?
I'm going to apply the cannula.
Or,
I'm suctioning first.
oh, that's right. You're suctioning.
Is that right?
Yeah, you're right.
Okay, and I was just thinking through, so I'm going to put on my hands, I'm going to get that into my sterile hand, and then I can take this aside.
Yep.
Okay, so here we are,
Okay, so now I'm going to don sterile gloves.
and I'm going to take this cup, keeping my hands above this area,
Yeah.
and I've got a mask on and some eye protection.
And you use your dominant hand for the holding the hose, basically.
Yes. Alright, so we've got our sterile gloves on now. I'm going to go ahead and come in here to get the cannula. I'm getting the cannula in my dominant hand here, nice and close up to the tip. We've got that all set. There we go. All right, and I'm going to go ahead and connect this hand here to the suction. And now this hand is going to test the suction. So,
Yep.
and I'm going to give it a test. That's not working.
I'm going to
Oh, I didn't actually test it together.
There you go.
There it goes. Okay. So I'm going to test the suction. Good. So that's working. And I'm going to go ahead and pull this to the side here. It's ready just in case we need it. There we go. So I'm going to go ahead and, Mr. Smith, I'm going to go ahead and insert the catheter here for suctioning. If it is too much, please give me a hands up. Raise your right hand for me, okay?
Okay.
You're going to feel me pushing this in. It's not going to be the most comfortable, but it should be okay. I'm going to go all the way down until you feel a little place where you need to cough. And then I'm going to go ahead and start suctioning up and out, okay? All right, so here we go. We're going to go ahead and carefully, oops, and I just broke. I just put my hand in there, so
Okay.
I would not do that.
Okay, but you said it, so yeah.
So in
It's
this
fine.
case, if I had done it, I would go get a new set of sterile gloves.
Yes.
Restart. All right, so here we are. Gonna go ahead, oops, without my thumb on the pressure, so it's not suctioning yet. Cough, cough. Great, I'm gonna pull back a bit. Great, and then I'm gonna slowly twisting, pull that back up. Good. Watching out to not, there we go. Great. And, wonderful, and then I'm gonna clear that a little bit. While we're here, I'm going to go ahead and reoxygenate you and give you about a minute to recover here. Oops. We also checked your O2 before we started. Yes, I listened to your lungs. So we checked your O2 before we started. Oh, I did see it was at 88.
You did, yeah.
Okay, and so looks like it's up, but still needs a little bit more. So we're going to go ahead and do another pass. A minute has passed. I haven't touched anything with this hand. All right, so we've reoxygenated and you're up a little bit. Good. Okay, so we're going to go ahead and do one more pass here. And being careful not to touch the surrounding areas. We're gonna go ahead and feed that in, good. And then you're gonna feel that place of coughing, good. I'm gonna back out 10 centimeter, and then I'm gonna suction. Twisting, suction, twisting, good. Being careful not to turn my back to the sterile field.
You ready?
Good. And good. Great. And I think I'll just clear that out there. Wonderful. Okay, I think that's pretty good. So before we stop here, I'm just going to go ahead and take that into this hand, and I'm going to undo those and put them over here into the trash. So these are no longer. And great. So let me go ahead and do a little hand hygiene here. Gonna put on a pair of clean gloves. And we're gonna go ahead and get this back on here. And nope, don't touch it. I'm gonna touch it. I'm gonna come over here. Turn this back down to your normal
Level.
medication dose, your dose, whatever. I'm turning it back down to 4 liters O2, and I'm going to go ahead and turn that off and put this over here. Going to go ahead. How you doing, Mr. Smith?
Oh, I feel better. Yeah.
Fantastic. I'm going to go ahead and do some more hand hygiene, and I'm going to go ahead and looks like your O2 levels are up at about 96%. That's fantastic. I'm going to go ahead and take another listen here. Okay. Good. Sounding a lot clearer. Wonderful. Good, good. Okay. So, gonna do hand hygiene again. I'm gonna throw all my stuff away. Off it goes. There we go.
Great.
And we're gonna go right into cleaning your trach right now while we're here. Before I do that, just so I don't forget, I'm going to document the appearance of your sputum, what came out. I'm going to document how you did with that. I'm going to document if I noticed any things going on. I'm going to document your O2 and your lung sounds before and after assessing and the suctioning. And then I'm going to chart that your oxygen is back at its previous level. I'm also going to document for the suction, the amount of suction that we put. And that's all we've got for that. So I'm going to go ahead and leave this here since we're going to be doing some trach care, and that's probably going to get a little bit messy. Okay, and I'm actually going to leave the O2 sensor on you just to make sure that we've got that going. So meanwhile, this is all. And then we're going to rotate and put our finger over that. Gonna put this over here. I'm just actually throwing this away. I wouldn't touch any of these things. I'm going to throw it away during the actual thing. Okay. And we'll do that later. Okay, so then I would go ahead and throw these away. We've got this water still sterile. All right, so I would go ahead and clean again. And notice that I've got my tracheostomy clean care trach and some water, some sterile water. I would have done hand hygiene. My mantra, when in doubt, hand hygiene. And do it. Oh my God. So hand hygiene. There's this. I'm gonna clean my area, sterilize. Okay, so we've got that. Now, we were coming into the room. I would want to make sure that I had on a mask and they had on a mask. No, that's for the central line. Okay.
But it's good for you to have a mask on regardless.
It's good for me to have a mask on definitely while doing this. So the bed is still up in a good position. The patient is still up in a high Fowler's position, which we did before, to make sure that that they could breathe better.
Actually, you do need a mask because if you're cleaning the trach, you don't want to breathe on it.
Yes.
So perfect.
Yeah. So I have my mask on. We've got the O2 sensor. We've just listened to lung sounds and they were sounding good and clear. So I'm going to go ahead and, this is on, I'm going to take off, let's see, got clean gloves on. I'm going to go ahead and open this in a sterile way, putting that there. I'm going to put that there. I'm going to actually, let's see, I'm going to take off gloves before I did that.
Okay.
I'm going to do hand hygiene. I'm going to open this. And I'm going to reach in here and take this out. Get my gloves ready. All right, and I'm going to go ahead and take this out. I'm not going to use it. I'm just going to toss it. So we're going to toss it over there. I'm going to go ahead, and I'm not sterile yet, so my hand went down below. I'm going to do hand hygiene.
Great. Good catch.
I'm going to take my water. I'm going to pretend that I'm pouring it in here. Here. Put that over to the side. Okay. So, all of my stuff is ready. I've got pipe cleaners. I have a string somewhere in there, I hope. Would you look in? Never mind. Stay right there.
A string, yeah. Grab my string is right there.
Okay.
No, it should be in there. It should be underneath.
Okay. I'm gonna look as soon as I put on my sterile stuff.
Yes, you can do that.
I've turned my back to the sterile feed. Okay. Hand hygiene. I'm gonna put on some clean gloves. Clean gloves. All right, and we're gonna come over here and put the duck aside. I'm gonna go ahead and gently, holding with one hand, get the cannula out there, making sure that the flange is in place. I'm gonna go ahead and put that in there and start it doing its thing. Just having a brain fart.
Hilarious.
Okay, so there's that. I've got that. I'm gonna look around. All right. Look okay. Okay, now I'm gonna go ahead and remove these gloves. And do hand hygiene. And then I'm gonna come on over here and we're gonna do these gloves. And inside the cup. Okay, and coming around here, I am going to, let's see, first I'm going to take this guy up and away. I'm looking for, oops, I didn't have the thingy. Oh look, there it is. Okay, and we've got, be careful not to contaminate the field. That's all right, we don't need so many. All right, so we've got that. Okay, so we're gonna come in here. This has been soaking for a while. We're gonna go ahead and do a little scrubbing. Scrub. Gonna get the outside of it. And the part where it goes here. And then I'm going to gently do that. And
Dry.
and
Tap dry.
and then dry. Let it dry.
No, tap dry.
Tap
with
dry. I
with the
did.
gauze.
Okay.
Yeah. Okay. Great. Yeah, there you're
Okay.
good.
And then we're going to go ahead and
Dispose. Yeah.
So both hands are clean, are sterile still. All right, so then we're going to come back here and I'm going to really carefully there we go. And get that back in there. Great. Sterile part is done. So then we can come on back and take a look at things. If we need to reoxygenate, great. If we don't, then I'm going to go ahead and take out the old strip. I'm going to throw that away, and I'm going to take there, and I'm going to go ahead and start cleaning around. Oh, it's not sterile anymore. I don't need to worry about that. Clean around the flange. And then I'm going to look under the flange. I'm going to assess the skin, looking for any drainage. Making sure that that is clean. Making sure that the cannula is not slipping out. And that I'm not blocking the patient's airway. Okay, making sure that that's clean. And then we're taking brand new dressing here. And we're going to slide it under. All right. So sliding under, again, making sure that the cannula won't pop out. Excuse me, Mr. Smith. You doing okay?
Yeah.
That's good. Put that underneath there. All right, making sure that there's no wrinkles. Sorry, getting this in there is just giving me a little challenge. There we go. Okay. All right. So that's in there. Everything is nice and secure. All right. And I'm making sure to check the O2 to see if it goes down at all. All right. And now, let's see. I'm going to have my assistant come in and just make sure that the flange isn't going anywhere, or that the cannula isn't going anywhere.
Okay.
Thank you, Vanna. All right. So we've got that through, and then I'm going to bring that, excuse my reach here, making sure that there's no, there we go. All right, got that side. Tie. I'm gonna swap places with you here. Oops, not over the top there. There you go. Oops, you don't want to cover that up there. You doing okay, Mr. Smith? I'm sorry, my arm is kind of resting on you there. Okay.
I feel so loved.
Oh, good. All right, so we've got that. And I'm just going to go ahead and tie a gentle tie over here. Okay, and then on this side. Good. Okay, I'm going to make sure I've got 2 fingers under there. It's firm, but it's not going to strangle you. Okay, there we go. We've got that. I'm going to go ahead and replace your oxygen and hydration there. And make sure to take off this old one. Old tie comes off.
Great.
And that all gets thrown away. One more time, I'm going to check your O2. Great, I'm going to listen to your lungs one more time before I leave. take this off.
Is that in the thing for this?
I don't know if it is or not. I'm kind of just saying it because.
Just to make sure.
Uh-huh. I'm going to throw all this away. Oops, I'm going to take off my sterile, which are now just clean gloves. I'm going to throw those away. Alright, and with that, I'm going to do some hand sanitizer. Okay. I'm going to take another quick listen. Still sounding good. Good. All right. So make sure again that your oxygen is on the right level. You're at 96% O2, which is fantastic. I'm going to go ahead and do one more hand hygiene. I'm going to make sure that your bed is low or mopped. Are you comfortable sitting up or you want to go down?
I'm very comfortable.
Okay, sounds good. So we're going to leave you there. Make sure that you got your possessions next to you in bed. That you got your call light, which you do. You don't need to use the restroom right now. And undue privacy unless you'd like me to leave it. And
I'm fine.
how's your pain level? Are you having any pain?
No pain.
No pain. Great. Fantastic. Okay, so I'm just going to go ahead and document what we did. We did the trach care. We changed the dressing. I assessed the wound or the ostomy, and it was looking good. It's pink, but it's not red. It doesn't have any weeping or the dressing that we took away had a little bit of some brown and serosanguinous fluid on it, so I'm going to document that. I'm going to document how you did with the dressing change and that we've got you back on your 4 liters O2 and then if there was any pain along with that or anything else. And great. And we'll go ahead and check in on you later. Unless you need something before that, just use the call button. Okay, and pumps are running. Great, so let me know if you need anything else, okay? All right.
Good job.